So it's important to have your wisdom teeth evaluated between the ages of 15 and 20 because in most people, the wisdom teeth are what we call impacted. And what that means is they haven't erupted through the gums like the natural teeth have. And the reason why that's a problem sometimes, three reasons really. They can cause infection because the bacteria that's naturally in your mouth can freely move between your mouth and below the gums when the teeth are impacted. And when the bacteria gets around the teeth, the impacted teeth like that, they can cause infection. The second most common complication with wisdom teeth is damage to the adjacent teeth. As the wisdom teeth try to erupt and there's not enough room in the arch for them to erupt, they can cause damage to the second molars. And the second molars are really important chewing teeth, whereas the wisdom teeth in this case would be impacted, so they're not being used to function. The third and least common complication with wisdom teeth, but the one that carries the most consequences, is cysts or tumors of the jaw can form around wisdom teeth sort of later in life. And that can be a big problem for some people. Yeah, it's really important to have the wisdom teeth evaluated by a dentist. We take a special x-ray, a panoramic x-ray, to really evaluate the position and the potential for them to erupt. In some people, they do erupt and become functional teeth. And in those cases, they don't need to come out. But when they are impacted, they again, there's a big risk for infection. Sometimes the teenagers will feel that sort of swelling and pain that kind of comes and goes, and that's the tooth attempting to erupt. And over time, that can develop into a serious, sometimes life-threatening infection. So the typical process that a teenager would go through when they're about to have their wisdom teeth out is, first they'll come into a dentist and have the x-ray taken so that we can evaluate the wisdom teeth. And then if we do determine that it's proper for them to come out, we'll schedule a surgery appointment. And during that surgery appointment, wisdom teeth removal is most of the time done under IV sedation. So it's not typically a procedure that somebody could tolerate awake. So we'll start an IV in the patient's hand or the arm and give them a little medication through the IV that will help them relax. And they'll relax to the point to where we can perform the procedure safely and then also minimize their discomfort. Most of the time patients wake up afterwards and don't really realize that they've even had the procedure completed already. So it's a really nice way to go through an otherwise somewhat miserable procedure.